of technical issues. We don't use it at all.
Yes, send a message now. Okay. I'm so sorry for everything. There's a lot of technical difficulties, but we're back. Please share the live. Please share the link. Shout out. Let everybody come and join, please. We'll be starting in a few minutes. The moment we reach 6 people, we're starting. So please just share the live. Let's get as many people as possible. My blessings I take out. My blessings I take out. It's plenty no amounts. Please help us share the live, share the link. Sorry for the technical difficulties. We'll be starting in a few minutes. Let's get to 6 people and comment. Thank you. God did it for me, and He will do it for you one way or another. I know they worry, 'cause I know He got me. Please help me share the live. Please help me share the live. Sorry for the technical difficulties. When we reach 6 people are commencing, it's going to be a great time. It'll make me want to turn around and shout hallelujah. Today is going to be packed. Today is going to be wild. Today is going to be rich. Please help me share the live. Let's get to 6 people and begin. Please, let's get to 6 people and begin. Please, let's get to 6 people and begin. Thank you, everybody that is joining the live. You're welcome. We're sorry for technical difficulties. Let's reach 6 people and comment the live. It's going to be rich. Sorry for technical difficulties again. Thank you. Let's get to 6 people. Please share the live. Let's get to 6 people. We're almost there. Everybody, welcome. Everybody that is here, you're welcome. 4 people are already here. 2 more people are commenting. Thank you very, very much. Shout hallelujah. Hey, 2 more people are commenting. 2 more people are commenting. Thank you very much for your engagement. Leave comments. Tell us about breast cancer. Tell us about your experiences. Tell us about anything you know about breast cancer. Any question, drop in the comment section. We are going to definitely answer them. We're waiting for 6 people and we're commenting. Please share the link. Please share the link. It's going to be a full, impactful day. Thank you. One more person, our commencing. One more person, our commencing. One more person, our commencing. We are 6 people. We are 6 people.
So we're starting. Thank you so much for giving your time to this. I bet you it's going to be awesome.
Awesome. All right. Okay. As promised, we are 6 of us and we're commencing. Welcome, everybody. Welcome. My name is Zishu Harris.
This is Kate Eposi.
And we are fighters. Welcome, fighters. Welcome, breast cancer fighters. You know, today or this week for me in particular has been a very, very hard week for us.
Yeah.
Like, it took a lot for us to do this live. We almost canceled the live, to be honest, but we're fighters. So I'm going to stick to the live to the very end. Yeah. All those who have joined, we're going to fight this breast cancer to the end. Yeah. So as I said, This week has been hard for me, but no matter what, we are fighters. So welcome.
Yeah, and as you know, we move. I tell you, the fight against breast cancer is not just the fight of the doctors, it's not just the fight of the nurses, it's not just the fight of the oncologists. It is a fight for every one of us. Whether you're a businesswoman, whether you have a white collar job, this fight is for every one of us. And the aim of this life is that at the end of it, you should become a better fighter than you were prior to this. So please be connected. Don't lose your focus on this life because it's going to be spicy.
All right, I'm going to shout out to Naomi Akali. Thank you very, very much for the love. And Beta, thank you very, very much. Please help us share the link. Let's get more engagement. Let's get more people here so we can start up. All right, today is packed, as I said. So I want to give you a rundown of the program. So I'm going to start with myths and facts. You know, we've heard a lot of stories about breast cancer, a lot of wrong ideologies about breast cancer. Today, I want to give you the myths. I'm going to cancel them out. Second, we're going to do prevention and hope. Anything that we're going to do, anything we have to do to prevent cancer, we're going to share it out to you today. Self-breast examination. In fact, if you miss this live, you have missed it, because you need to stay on to the end to get self-breast exam. You will come out from this live thick. And at the end of it all, I want to do a Q&A. Any question ever had a breast cancer, anything, ask it, drop in the comment section, and any experiences you've ever had before. There's a relative that died, a friend that died, you a patient in the hospital, anybody, drop it down in the comment section and share.
So before we begin, we get into the deets of the program. I just want to share this story. You know, I knew a lady who was in her late 30s. She got married late, and when she had her first conception and childbirth, breast cancer stepped in. I tell you, it was a fight. It was a hustle for all of us because there are surgeries involved, chemotherapy involved. In fact, the treatment was a whole different thing. So we all have our experiences with breast cancer, and it fashions our beliefs about breast cancer and even cancer as a whole. And that's why we want you to share your experiences with breast cancer so that we can all work on them.
All right. Now we'll go to the myths of breast cancer. The very first myth that I'm going to break down, that men can't have breast cancer. Have you ever heard of it before? It's a lie. Like, it's something we hear on a random.
Yeah,
like a guy made me the other day. I was like, Harris, what are you doing? What's the lie for? I cannot have breast cancer. So why should I join the lie? Imagine, men can have breast cancer. As far as you have breast tissue, you can have breast cancer. In fact, now, out of 1% of the diagnosis of breast cancer is men involved. You understand? So keep this in mind. If you have breast tissue, you can have breast cancer. And 1 out of every 729 men are diagnosed with breast cancer in their lifetime. So men can have breast cancer. It's rare, but they can have breast cancer.
The second myth we want to share is that a lot of people believe that women who have breast cancer, it stems from a family history of breast cancer. No. Even women, majority of the women who have or who develop breast cancer do not even actually have a family history of breast cancer. And so there's a lot of wrong notion going out there that, oh, it means if your family member has, then that is when you can have. No, that's not the case. And there are many other risk factors that step into predisposition for breast cancer. For example, if you're living a very sedentary life, meaning you're not involved in a lot of physical activity, you're taking alcohol, and you're obese, those are risk factors that could predispose you to having breast cancer. There are even environmental factors, for example, exposure to radiations. Maybe at your tender age, you were exposed to a lot of radiations, especially around the chest area.
Yes.
Those are risk factors that stem up to cause breast cancer in the long run.
Another thing is, if you had your menses at a very early age, you are exposed to breast cancer.
Yeah.
If you enter menopause at a late age, you are exposed to breast cancer. She also said women of older age, we're talking 50 and above, you're at risk of breast cancer. Today's report, thank you very much. Thank you very much for the love. Drop your comments. We're going to engage with you. Drop your questions.
Yeah.
Anything you doubt, drop them. And please share the live. Let's reach as many people as possible.
So one of the other myths is that when you find a lump in your breast, it's breast cancer. No, my dear. It is not breast cancer. Usually, breast cancer sometimes doesn't even present with a lump in the breast. And if you find a lump, it doesn't mean that it's cancerous. It could be benign, it could be a fibroadenoma.
It can just be a cyst.
Exactly. So, it doesn't necessarily mean that it is breast cancer. And there are other signs that you're supposed to see along with the lump for you to start suspecting that, okay, it's breast cancer. For example, there could be a change in the skin over the breast. It could become reddish. It could become dimpling, or it could even look like the peel of an orange. And all of that, there could be pain and swelling of the breast, or maybe part of all of the breast. All of that should point your attention to, okay, something is going on here.
All right. That is true. So just take note of that. I'll just reiterate. The breast will be swollen. You have a pale orange kind of look. You know how the back of an orange looks like?
Yeah.
That's how your breast is going to look like. You might feel a lump. You might have a discharge from your nipple. All those are signs of breast cancer. The next myth is breast cancer always presents with a lump. Breast cancer must always present with a lump. You can just have other signs. Remember, I've enumerated the other signs above.
Yeah.
Pain, discharge, but again, tolerance. If you're following up, just give me the comments down in the comment section. All of that signs can present with breast cancer. So don't necessarily think that, oh, if I have these other symptoms, I have these other signs, but I don't have a lump, that I don't have breast cancer. It's a lie. You can have these signs without a lump and still have breast cancer.
Yeah.
Thank you everyone for joining. We're already at 10 people. Please keep on sharing the live. It's going to be an impactful session.
Yeah. Or moving on to the next myth, a lot of people believe that wearing bras that have underwire cause breast cancer.
See?
I mean, all of us have believed this at some point in our lives, but
see, I met a patient in the hospital. The patient told me that she doesn't wear bra again. I'm talking about a 20-year-old girl. She told me that she doesn't wear a bra again because it's going to give her breast cancer. Imagine that mindset. So she's walking around without breast wear, very seductively, with her nipples pointing everywhere because she believes that if you wear a bra with an iron under, you're going to have breast cancer. It's a lie.
It's a lie.
A very fat lie. There is no scientific relationship between wearing a breast wear that has iron and having breast cancer.
Mm-hmm. And usually they were bothered about it because they felt like, okay, you wearing a bra is going to reduce the drainage of lymph from your chest area and then can cause the cancer. But the search, and there is no scientific proof. So please wear your bras. Please wear your
bras. Don't walk around your nipples being exposed. All right. The next myth is if you're using deodorants and antiperspirants, you're gonna have breast cancer.
I thought about this too.
Like, I don't blame you for what they think, because obviously you're around your breast, so anything can just get absorbed to your breast. So I don't blame you, but I'm here to break those myths. It's a lie. Please use your antiperspirants. Don't go around smelling or whatever. You will not have breast cancer by using antiperspirants or by using deodorants.
Yeah.
Please, it has no scientific relationship, it has no direct relationship. You will not have breast cancer by using deodorants and antiperspirants. You have to go ahead. Please continue.
Yeah. And the other myth I want to share is this one is very, very common in families, because people believe that when my mother has had breast cancer, I could also have breast cancer, or when my great grandmom had. Cancer is not contagious, and they are thinking about it because of the proximity. Like, this person is close to me. It is not contagious. It's not tuberculosis.
Yes, it's not infection. Actually,
infection. So it's not a contagious disease. It has nothing to do with infection from another person like that.
Yes. So and this thing now, I don't know how I have a lot of experiences with this.
Yeah.
So I had a patient who was examining the hospital at one point. She had like a lump plus different things on her breast. So when I was touching her and examining her, she told me not to touch her breast because I'm going to get breast cancer. You understand? So I don't blame you people, because it's the wrong decision that's outside. I will not examine you and have breast cancer. I will not touch I'm beginning to say infected breast. I will not touch your breast that has breast cancer and have breast cancer. Never. All right. The next myth is breast cancer. Any breast injury is breast cancer, or any breast can lead to breast cancer. Not necessarily. You cannot have a wound here, an incision here, and they have breast cancer. No. Don't be afraid. If somebody stabs you there and you're afraid they have breast cancer, no, you won't have breast cancer. I just want to shout out to everybody that is here. We have 13 people on this live. Thank you very much. We're shouting out to Rami, Roland Jr., Akem, thank you and welcome. Please drop your questions. We're going to definitely answer all of them. Roland, we're going to answer your question in a jiffy. Okay.
And also, with respect to the injury causing a breast cancer, as people think, usually it's because these people, when they have an injury to the breast, they develop a lump in the process of healing. And immediately they are thinking like, this is breast cancer.
Yes.
It is not. It is not breast cancer. It could be benign, you know. And if you do find a lump after an injury, the lump has to be evaluated for us to say, okay, it's a cancer or not. So,
yeah. All right. And the last myth we're having is sugar feeds cancer. Sugar feeds breast cancer.
It's everywhere on the internet.
Sugar feeds breast cancer. I'll not blame you. I don't have to say it's technically correct because sugar feeds all of ourselves. So it's not just breast cancer. So people tend to avoid eating sugary things, yahoo, biscuits, fast foods because they think it's going to feed the cancer. It doesn't feed cancer. Sugar is in there for ourselves to function properly. So move that notion. Sugar does not feed breast cancer. All right. We have scattered the myths. We have broken down the myths and everything you need to know about. Okay.
You know, people believe that this one is very common, that young women cannot have breast cancer. You know, like the belief is everywhere. When you tell young girls about having a breast cancer disease, they're like, I'm young.
Yeah.
I'm 21.
Yeah.
But young women can actually have cancers because breast cancer accounts for 25% of cancers in women.
Yes.
And the age is not even given like, okay, you must be between, So please, whether you're young, you're old, we're all at risk of having breast cancer, and you should do the self-breast examination. In fact, that's the highlight of this live, I tell you.
All right. She did the last one. So we're done with myths. If you're coming late, you've missed the myths. You just watch the live. Now, the next thing on our agenda is prevention and hope.
Yeah.
You know, we cannot go through this life without telling you how to prevent breast cancer. Mm-hmm. Yes, I think we're going to answer the question of Naomi Akali. You cannot go through this life without preventing breast cancer. And as I said, we are fighters. So it starts from us. As you have a breast, you can have breast cancer.
Yeah.
All right. So I want to just run through how to prevent breast cancer.
Okay. All right. So to prevent breast cancer, I tell you, the body that God gave you, right, is your body, yes, but He's going to hold you accountable for everything you do with it. Yeah. Because a lot of diseases can be prevented by doing very common things that every individual should be doing. But because some of us are too occupied, we don't want to do it. For example, physical activity is very important in helping you to prevent not just breast cancer, but a lot of other diseases. So please keep yourself engaged. Go to the gym. I mean, take walks. I'm sure majority of the people on this live are actually staying in Buea, and you can walk in the morning. Please do physical activity. Another thing that you can do that will help you prevent breast cancer is you ceasing from alcohol, my darling. Please keep the Hennessy aside. Keep whatever it is you're drinking. Chill.
Yes.
Barondo, Madrid, and whatever. Yeah. Please reduce the alcohol. Even the same thing with smoking, all the shisha and all the things.
Emphasis on shisha.
Please, smoking has to stop. Those are some of the things that put us at risk, predisposes us for a lot of diseases, and many people don't even know.
All right. That's about physical activity and health. Now let's go to our diet. Our diet plays a very big role in prevention of breast cancer. Yeah. First, we have to eat healthy. We're talking vegetables, fruits, whole grains. Avoid fast foods. Secondly, we have to also prevent or avoid saturated fats. Yeah. I think some example of saturated fats we were giving the other day. Animal fat,
cheese, the butter.
So reduce. In fact, you cannot completely cut it off, but reduce your consumption. I'm guilty of such. Nobody's perfect. I'm guilty. So I, as a fighter, I'm going to reduce my quantity of saturated fats. Yeah. Okay.
So I think we should answer a few of the questions that are already here.
Yes.
And Roland Jr. is asking, as a muscular guy, how can I self-identify if I have breast cancer? This is going to be answered
in a few minutes. Exactly. I'm very happy you have such a question.
Yeah.
because part of our package is self-breast examination. So stay to the very end. I'm going to teach you how to examine that breast properly. Yeah.
Okay. And Naomi Akila says, I wish to ask how we can reduce the prevalence of breast cancer. So basically, to reduce the prevalence of breast cancer, we must be able to identify it way ahead of time so that we have it how do I say we have it treated, or we have it attacked right from the start, so that it reduces the number of women we have who are suffering with the disease like that. So it is a matter of early detection, which will stem all from self-examination, which is the highlight
and
of
regular screening.
Regular
This
screening,
October, I think there are like 10 campaigns on health on breast cancer, and during the campaign they did the screening and everything. So one thing to do: join the fight, join the regular screening, do a screen every month. And apart from the hospital screen, self breast examination, which I'm going to teach you in a few minutes. That's like the primary. 8 in 10 women that had breast cancer were self recognized. It's them that found a lump. They went to the hospital, 8 in 10. So imagine that's like the first line, self-breast exam, regular screening, and they will give you the risk factors and also give you things to prevent and do exercise and the rest. Those are the things for us to reduce the prevalence of breast cancer. Yeah. So another thing is, if you know Angelina Jolie, that I love that story so much. That's a woman with confidence. Like, she knew her mom died of breast cancer. She cut off her breast. That's the same thing. If you know you have a family history of breast cancer, you have to do 10 times what a normal person will do.
Yeah. Get yourself screened for the gene, for the BRCA1.
Yes, BRCA1 and BRCA2 gene. Yeah.
And I think she did the screening for the gene, and they saw it, and that was why she went on to have her breast taken off. So
okay. So Naomi Akali, I hope I've answered you. Any other question? Please leave your questions. I'm going to definitely answer them. Yeah. Give me your experiences. Give me anything you've had in the hospital, a patient, a friend, anybody. Tell us anything. Tell us. We're gonna join you. So I think we learned something out. Apart from also talking about limiting alcohol and smoking. We've spoken about this a lot. I know the funny thing about it is that all these risk factors, we know them, but we don't want to take them into consideration. Mm-hmm. We tend to satisfy our flesh and not take these things into consideration. Yeah. Smoking, alcohol consumption, they are going to increase our risk of breast cancer. Mm-hmm. Definitely. So, please, so I've given you already. Naomi, I've already answered your question. Any other question, drop them in the comment section. Experiences, Q&A, anything, tell us. So, I think we're done with prevention, I hope. Or like 23 minutes into the life. Now, once get into the heart of this life. If you know you are not yet shared this life, share it though. Share it. Look at ask me how do you do self-breast exam? I'll not answer you. I'll sit down and check my life. That's right. So share the life now. I want to do self-breast exam. This is so important. I cannot even begin to scream how important it is for you to pick it out yourself and not hold another person to do it. Yeah. I'm going to teach you the pros, the cons, for you to pick out. Hey, I'm coming to come and enjoy your breath, and I'm coming to come and examine you. Mm-hmm. So who starts? Because I'm so excited to teach this. Okay, I think my colleague is going to, me. Okay, a pleasure. All right. Since I cannot directly expose my breast, I want to use a globe as a breast. Consider this as your breast. So we're going to use this to examine our breast. And there are different steps and there are different places for you to examine your breast. As I said, both men and women can have breast cancer. So this thing I'm about to teach you now it's important for both boys and girls, or for both men and women. Now, using this globe, for you to examine your breast, you have to divide your breast into 4. So you see how this globe is. You see a line in the middle. It's the same thing, and this line here. So you take a breast and divide it into 4 first. That's how you're going to start. So normally, so it's advised that you do self-breast exam 7 days after your life. Oh, let's see. Welcome. Like we got to do this. So so as I said, it's always advised that 7 days after your period, you carry out a self-breast exam. So while in the shower, you're bathing, and what do? You divide your breast into what? Into 4. So as I said, you're going to examine your breast in quadrants. So all these 4 pieces, they call them quadrants. So you use the pad of your fingers, your 4 fingers, they call this the pad. You don't examine the breast like this. You always feel like there's a lump there because you'll be touching adipose tissue and fibrous tissue.
Yeah.
So you don't use your fingers like this. Say you go to the hospital and the doctor's like, I want to do a cell-based examination on you. And he's
And it
coming
comes
like this.
Yeah.
My sister,
It's not-
run!
It's no longer an examination. It's something else.
Yes, it's coming for its own sexual satisfaction. You don't examine the breast like this. The part of your 4 fingers, and you go. Now, what do? We have 4 quadrants. How do you do it? Tell us. You just continue.
All right. So with the parts of your fingers, as you rightly said,
Yeah.
you're going to examine each of those 4 regions that you've divided the breast into, starting from the upper right. So you're going to examine. This is called, we call it palpate, but you're gonna feel, and you're moving your hand in a circular motion
Yes.
throughout the 4 segments. So you examine here, you're feeling if there's any lump or anything. You feel all the 4 regions that you've divided the breast into. And if you identify that there is any lump, my dear, it should be evaluated. Don't neglect it. It should be evaluated.
Okay, just to add, when you're examining, you're going from outside to inside. So you don't just take your fingers and you start from outside and you're going gently inside. Likewise, on all the 4 areas. So make sure you divide your breast into 4. And then you do that. So consider this the nipple. So after doing that and palpating with your 4 fingers, you squeeze your nipple for any discharge or pain. Then basically that's it. So still using the 4 parts of your fingers, you go to your armpit as well.
Yeah.
I think my armpit is not showing in this slide. Yes, but you go to your armpit as well, and you palpate. Use the 4 parts of your 4 fingers and palpate in a circular motion. When you're doing searching for any lump, anything you can pick out. Keep an open mind because some people feel like sometimes you feel adipose tissue. I think it's a lump. It's not a lump. I had a patient like that. She had adipose tissue enormously, and she felt like she had lumps and she had breast cancer. It was not breast cancer. Just keep an open mind. You can have just adipose tissue. So when you're done in the shower, now you come in front of the mirror to look now for the signs, because you don't necessarily have symptoms. For breast cancer, you have signs. So when you come in front of the mirror, you take off your dress, you're naked in front of the mirror. You alone, no, not you and your boyfriend or you and your husband. In front of the mirror. Okay,
some questions coming in.
Okay, so I don't know. Let me just answer this question. Since we're on breast exam, Rami has asked 2 questions. The early signs of breast cancer. When we're giving up the myth of breast cancer, we narrated some signs. You can have a lump, or you might not have a lump. You can also have an orange pale skin. You know how the back of an orange looks like. That's how your breast is gonna look like. You can even have a wound or an ulcer. You have a discharging nipple. Your breast is going to be painful or tender in medical terms. So basically, that's it in the simplest possible way. And the next question is why the armpit? Okay, when breast cancer has a way of spreading, it spreads through what they call lymph nodes. So we're going to the armpit because we want to examine the lymph nodes. That's why we're checking your armpit. So we're looking for enlarged lymph nodes in the armpit. So basically that's it. That's what we're doing in the armpit. Looking for enlarged lymph nodes. And sometimes you might think that adipose tissue is enlarged lymph nodes. No. So you have to keep an open mind. And as she said, if you see any lump, don't neglect it. Don't say, it might be but go to the hospital first. All right, we're in front of the mirror. So when you're in front of the mirror, you're looking for what signs of breast cancer. You yourself will pick it out first. The first sign of breast cancer, it's you. As I said, 8 out of 10 women that were diagnosed with breast cancer picked it out themselves.
Self-examination.
You understand?
Self-examination.
So I think we should do it. So in front of the mirror, you don't do it.
Yeah, I'll do it. So in front of the mirror, this is very simple. Like you said, you've already examined in the shower, and now you're in front of the mirror, you're looking for your signs. You're looking at how your skin looks like. Does the skin on the breast, has it become reddish? Has it become discolored in any way? Please, you should know. Yes. You should also be looking at if there is any wound, like she said, any ulcer or anything that is building up anywhere. You can even see there are some people who actually have lumps that when you look at them like in front of the mirror, you're already seeing that there is a mass or something growing in there. Please, those are things you're looking out for. And when you there's another way you could examine your breast when lying down flat.
Yeah.
When you're lying on
That's
the bed,
after the mirror. When
yes,
you're done with the
when
mirror.
you're done with the mirror, you're lying down flat. You could place your arm like this. That's if I want to examine my right breast. So my right hand, sorry, goes behind my head, and this gives me the position for me to be able to examine the breast, all the 4 regions. And don't forget your armpit always, please, your armpit. So when you've examined all the 4 areas, then I will go to the armpit and also examine for any lymph nodes. If you feel any nodule, anything, please. I think there's a question that has come in about identifying.
Before we do the question, let's welcome those who are here.
Yeah.
Yes, Abby, welcome. Thank you for joining the live.
So much.
Paco Jordan, thank you very, very much. Keep sharing the live. Please keep sharing the live. All right, the question. So how do we distinguish between adipose tissue and a mass when palpating? All right. Okay, how to distinguish between it? I told you how to palpate your breast. Use a part of your finger. So if you're using a part of your finger, you will not feel adipose tissue. You will feel a lump. But if you're going with your fingers in a, I don't know how to say, pointing where, you definitely feel the adipose tissue. So use the part of your finger to be sure that what you're palpating is a lump. Because when you go with your fingers flat, you press the adipose tissue down, so you don't touch it. So that's what you're going to be sure by using the part of your fingers. Don't go like this. Go like this.
And usually, if you do feel any lump and you're identifying that it's a cancer, usually it's going to be irregular. Like when you palpate it, the surface is not going to be all that smooth.
Yes,
like that.
Yes.
It's going to be rough. It's going to feel weird from all the other tissue that you've palpated. So when you're doing your breast examination, you have to be really keen. It's something that you have to be intentional before doing it, because if you're just doing it for doing it, keep an open mind while doing it.
Okay, so basically as it was you're lying on the bed and whatever.
Okay, so you're lying on your bed, and like I said, you're examining your right breast. You examine all the 4 regions from the inside to the outside. So when you examine all the 4 regions, you repeat the same thing on this other side. So if I'm examining my left breast, this is my position. This is how I'm going to be on the bed while doing that. So,
and also if you suspect you have a lump on one breast, always start from the side that you don't suspect there is something wrong with it. Always start from the normal breast. Because it's easy to compare an abnormal something to a normal something.
Yeah. And usually, I think we forgot to mention this. You know, there's also the tendency of having a difference or a varying size of breast, like that. When you start noticing stuff like that, especially if the difference is huge, darling, please examine that breast very well.
Yes.
Like, so seriously.
So, Roland Jr., I hope you have understood now how to examine a muscular breast.
Yeah.
As I said, and I'll emphasize, if you have breast tissue, you can have breast cancer. And I'm very happy that a guy asked this, not a woman. All right. So, I think we've touched all the aspects of our life, everything. If you have any question, anything you want to ask now. Well, we still have the time.
Yeah.
Drop your comments. Anything you want to ask. It's now or never. Oh, it's now or never. Anything, any myth you heard, anything
you want to share with us, please share. We're going to read it out loud. While we're waiting for the comments and any other question, we just want to sincerely really appreciate you all for joining this live. I mean, it means a lot to us.
And see, I want to say this. I have 15 people that are watching now. I want to say this particular thing. You should listen to me. This week, it has been a hard week for me. If you know, you know. It has been a hard week for me. I almost not to the life. I said this at the beginning of the life, but many people were not there yet, and they're there now. It was a hard week for me. I almost not to the life, but I'm a fighter.
Yeah.
You're a fighter. So I'm gonna do this. I want to fight against breast cancer.
Yeah.
I mean, we should bring down those numbers, men and women, because why?
We're fighters.
All right.
Seriously.
Okay. I think that's all. Basically, we have done everything. We know how to make it very lengthy, but I hope you have learned something today. I hope you have learned about your breast, the risk factors, how to prevent it, regular screening, signs, mostly signs, rarely symptoms, and you know how to divide your breast. When you go to the hospital, don't let anybody enjoy your breast.
Yeah.
Because
don't let anybody harass you.
like this. Oh, if they come like
Assault
this,
you.
run. Okay. I have a question.
Okay. So Tess Abby is asking, does sucking of the nipple reduce the risk of developing breast cancer? A myth I've heard. So she's asking if that is a myth or that is actually something that works. Now, I want to say yes, it works. Please, it's not just a myth. That is why women who have not conceived, women who get into marriage late or who conceive late and have children in their late 30s, those kind of age ranges, are at high risk of having breast cancer because they've not had a child, they have not had they've not been suckling a child for how many years, man? They're 30 years old.
Yes.
My. So please, it's true.
And the reason also is because when you give birth at a late age, it means you're be exposed to estrogen. Estrogen is a hormone. It helps for the growth of this particular cancer, breast cancer, any gynecological cancer, or estrogen. So when you give birth late, you give that the risk factors.
Yeah.
If you ball late, if you have late menarche, if you have early menarche, late menopause, let's say menarche, menses, sorry for the medical terms. If your menses starts early and your menses ends late, you have risk of breast cancer because of excess estrogen. I wanted to answer a question before about apoptosis to explain why it's not an infection. Okay.
All right.
Yes. Okay. You remember how the myth we talked about was breast cancer is not an infection. Remember, it's not contagious. The reason is because I want to just put this in a very, very simple term, how I teach my patients in simple ways. Breast cancer is just that your body has lost the ability to destroy cells. That ability to destroy cells is known as apoptosis.
Yeah.
So when the body or these cells don't apoptosize or they don't carry out the process of apoptosis, they don't die a natural death. They keep on living and expanding their lifespan that they're not supposed to expand. They cause breast cancer. So
more like infection. Somebody we know.
My God, I'm not girl. I'm not okay. Anyway, as I was saying, so if when these cells continue to live their life, they have to die at maybe 120 days or something. For example, and they don't die at that 120 days, they extend their life. This is not that override the process of apoptosis. So that's why we become to have breast cancer. So breast cancer is just a normal cell that has refused to die. Just keep in your mind, it's a normal body cell that has refused to die, and that's why the myth that says that sugars feed cancer doesn't work, because cancers are normal cells. Every cell eats glucose to grow, so it doesn't directly affect the cancer, but it's a risk factor in terms of you eating a lot of refined foods, fast foods, and it can put you at risk of breast cancer. Basically, that is it. Any questions? Please drop your questions. We're still here.
Thank you, Washeke. Oh my God. So all the way from Kenya. Thank you.
Thank you so much. Thank you. Lots of love from Kenya. Many, many hugs. Thank you. Thank you very much. Any questions, please drop them. We're going to answer them. Any question. We're here for you. Anything. Think it up now before we go. All right. Tessie Abi says, sorry, I missed the risk factors, but I would like to know if feeding habits like eating too much sugar, fatty processed foods have a bearing on being at risk of breast cancer. Yes. You missed it, but you know it.
That's right.
You missed it, but you know it. All these things you have enumerated are risk factors for breast cancer. We enumerated in particular saturated fats. Today we're trying to give us cheese,
butter, animal fat.
Animal fat in particular. If you consume these type of fats, saturated fats, you are at risk of breast cancer. Other risks are if you're an old age, sedentary lifestyle, smoking, alcohol consumption, early menses, late menopause, late childbearing age, you're not breastfeeding. All these things are some risk factors of breast cancer. Doesn't necessarily mean that if you are in this group of people, you have breast cancer, but they can expose you to breast cancer. An important thing for us to know before we end this life is that make sure you go for your gene testing.
Especially for people who've had people who are close to them,
Yes.
like your mother, your aunt having breast cancer, please do your genetic testing. Know whether you have the BRCA1 or BRCA2 gene, because you can only attack something if you know that there is something, going on around. So please do your gene testing.
All right.
Tessie Abby is asking again, how about methods of processing food like microwaving, air drying, and grilling? Yes, basically cancers stem up from exposure to radiations, electromagnetic radiations. So electromagnetic radiations are just propagated electric or magnetic waves. So if you had anything that exposes you to propagated electric or magnetic rays, then that thing can cause you a cancer. So microwaving, definitely. Those are methods of food preparation that we should limit how often we use them. That's if we must use them, we should limit how often we use them.
All right. Okay. I just want to also say something again. There was a question I had before. What is the difference between a mammogram and a breast ultrasound? What's the difference between? Anybody can answer that. Anybody. A mammogram. I don't know if you have done it before. If you have done a mammogram before, you've done a breast ultrasound before, tell me why you did it for. If you have done it, just tell me, and why did you do it?
Do we have anybody on the line?
Anybody who has done it before?
Done screening like that, who has done maybe a mammogram, or maybe the person has done a breast ultrasound. Anybody?
Apparently nobody.
So a few people screen.
Nobody's screening. My goodness, this is
very few people screening out here.
Yeah.
And it's if we have to reduce prevalence, those are the things at the top that we have to be doing in order to reduce the prevalence. We have to screen, man. Even myself,
I think that all of us are in this part of soup, but we are fighters. So I'm gonna change
the narrative.
Yes,
we're changing the narrative, please.
Yeah. Okay, so basically, breast ultrasounds are usually done for younger women. Women that have both adipose tissue and fibrous tissue, usually done for younger women. While mammograms are usually done for big older women, that's women that have no fibrous tissue, just adipose tissue. Another thing is that mammograms help us to pick up the lumps. You understand? So if you have a lump, it's best to do. All right. Naomi's answering. Thank you very much, Naomi. Okay. I love this. People are answering. And Beta says she has done an ultrasound. All right, thank you very much. Naomi says mammogram uses X-rays, while breast ultrasound no X-rays are used. Yeah. Okay, very true. Thank you so much for answering. And basically that's it. Another thing is that all these things, breast ultrasounds, mammograms, are necessary in reducing the prevalence.
Yeah.
Early detection, screening programs. So breast cancer awareness month is coming to an end. So I'm basically closing the month of breast cancer awareness. Really? So let this month not go by without you doing a self-breast examination.
Yeah, please.
After this live, whatever thing I taught you, whatever thing we taught you, put into practice. Try to cut off the risk factors. It's not easy to directly cut off 100%, but today I am trying to cut off the risk factors. You try to cut off the risk factors. For together we'll fight breast cancer. So we're giving you a few more minutes to ask your questions, because after this we're ending the live. Anything, ask us anything. Akem Julius is asking a question.
He says, you did mention on men being prone to breast cancer. Can you highlight on it? So we said that breast cancer it affects both the male and the female gender. So if you're a man, it doesn't mean that you cannot have breast cancer, because men are at risk. As long as you have a breast, you are at risk of having breast cancer. And we're saying this because there's the notion out there that a lot of men cannot have breast cancer, like you rightly said in the comments. But actually, men can have breast cancer. So even men have to do the examination of their breast. You can notice something happening. A lot of men they are not very superficial, so they're not going to be checking all of that.
Please
but for
check.
yourself, check. For
after
your
this
good,
life,
please check.
make sure your mindset changes. You have to check your breast. Tell your brothers to tell their uncles and their brothers that they should check their breast.
Yeah.
Alright, another question. Roland.
Okay, so Roland Jr. is saying this is not related to breast cancer, but I get a little skeptical using my Bluetooth headphones for so long. Please, can this cause any form of cancer? Like I said, if it is a propagated electric or magnetic ray, it's going to cause cancer.
Yes.
And like I tell you, if you own a cell phone, there's this thing I always say, I said it even in my church. I say, if you own a cell phone, please, you're at risk, because this alone exposes you to those rays. And that's why a lot of people like to say, don't sleep with your phones by you, keep your phones a distance away. You should not always be with your phones. Please, yes, it can.
It can cause breast cancer. Please drop your questions. We'll be ending our live soon. Any question, drop them. I'm gonna answer them before we end the live officially. Any questions, any experiences, any changes, anything you plan to impact, please tell us before we end the live. Anything, ask now, or remember forever remain silent. Ask now, because this month is gonna end. And before you hear anything about breast cancer, it will stay. It will be a big thing.
One whole year.
Yeah. So ask now. Please, my goodness, please don't forget to subscribe to this channel for more health things. You cannot come to this live and go. They are not yet subscribed. No. Support your girls. Follow me on Instagram. Follow me on Facebook. Follow me on TikTok. I give good health tips. I want to change the world. We want to change the world.
Yeah.
So help me help you change the world. Follow me on Harry's Health Tips, and I'm going to help you a lot. And follow my colleague on
Facebook. Because I'm not on Twitter. Seriously, I ain't on Twitter.
Okay. And F4C, I think Suzy Kate.
Yeah.
Alright, please follow us, give a like, share this live and everything. Okay. It's like nobody's talking again. No one is saying anything. Okay. Okay, Ambeta says there is a free screening on 31st October at Checkpoint Moliko in front of the stage. Okay, that's nice. Alright, thank you so much. So please, you have heard that video for a free place to go and do your screenings.
Yeah.
Go there, check your breast. You don't know, just rule it out. If you have it, you have it. If you don't have it, then it's good.
Yeah.
Alright, I've come to the end of the live. It was a beautiful session. Everybody that joined, I'm grateful.
We're grateful.
Like, we had some technical difficulties, but we overcame and everything. So it's been a wonderful time.
Yeah.
And definitely we'll organize more lives because we have seen the engagement and it was wonderful. Thank you so much, and see you during my next live. It's Harry's Health Tips.
Bonne soirée.
Bonne soirée. Okay. One way or another.
I'm not the mother, 'cause I know he got me. He done make me dance, break it down. He done make me want to
Grab my hand.
He done make me want to turn around.
He done make me shout hallelujah. He done make me want to break it down. He done make me want to clap my hands.
He done make me want to turn around and
Shout hallelujah.
outside the
Hey.
blessings.
All right. Bye, guys. Bye.